me, not Amanda, and hopefully a bit easier and less stumbly presenting what I was prepared to present. So thank you, everyone. So this does build nicely off of Amanda's piece because you saw an element in there. And one of the things that I've been really passionate about for years is ensuring we can standardize across protocols in terms of the actual expertise of our qualified exercise professionals, the fitness professionals delivering this. And so I'm going to speak a little bit too on the training that we are in progress developing. Many individuals on the call are part of this as well. Disclosure, I'm the co-founder of Thrive Health, the education for fitness professionals and exercise oncology online training. And we use this across almost all of our projects, providing really that educational background. So we've got a standard level of knowledge across our professionals. And so when we thought about building this pediatric cancer and exercise training, it really came from the need to have this standard for training of QEPs, qualified exercise professionals. And this can include a range of individuals from clinical exercise physiologists, registered kinesiologists, certified personal trainers, fitness instructors. We have all sorts of different designations. People can be a Zumba instructor, a group fitness instructor, or YMCA trained, et cetera, and many other fitness designations. And so people come with these varied backgrounds. And in a lot of our work, we are taking people that already exist, people that are trainers, that people work in the fitness industry, and we're bringing them into our oncology world, whether they come in as graduate students with a fitness background or they are people that are teaching yoga in the community and they really want to work with this cancer population. And so the gap for us, they are good fitness instructors, but they don't know the population. And that's really then where the cancer-specific training comes into play. It allows us then to build standards for a baseline level of knowledge across our studies and programs, really formalizing the knowledge and skills of a QEP working specifically in cancer care. When we have this base of knowledge, then we can take our structured protocols that are evidence-based exercise intervention and move them to practice, knowing that we're not going to have that gap of, oh, we have a good protocol, but our professional delivering it doesn't really know the population, right? And so you really need both pieces, that strongly designed exercise-based intervention or evidence-based exercise intervention, and then the person to deliver it. If you don't have the training of the person to deliver it, I would argue that you could have a good protocol, but it might not be translated in the right way. And so when we talk to fitness professionals who are interested in working with this population or that we're starting to train, we really look at our training as a new tool in their toolkit, right? They might have already had an undergraduate degree in kinesiology, or they might have been working in fitness with years or working with children in healthy populations for years. Now we're giving them the tools to work specifically, safely, and effectively with children with cancer. So we've based what we've built off of our Thrive Health model, which is an online work at your own pace, asynchronous learning delivery. We rely on expert delivery. So everything we deliver is evidence-based content, and it's updated at a minimum every 3 years so that we can take the new knowledge that is coming in and ensure that that is translated into the information that it is in our educational training. We provide as many resources as we possibly can. So the access to the actual, obviously, the training, the recordings, the slides, the handouts, manuals, other resources to be used. So examples of progressive programs, for example. So we want to ensure that individuals can take all this information, and it's not you hear about it once and you have to remember as much as possible, but they get everything able to download. And then we've really built our model being one that can be feasible and result in sustainable delivery as a training program by keeping it really low cost and ensuring we can increase access, reaching more individuals and training more people that maybe wouldn't have had access to it anyways. So the program and how it works, and I'm going to work up to the pediatric specific, but starting with the kind of base knowledge is our Thrive Health Cancer and Exercise program, which has 9 modules. It's about 15 hours of online learning, longer if somebody's pausing it all the time to take down notes or flip through different things, but it's around 15 hours of recorded content. And again, it's evidence-based, and it includes all of the resources that they need to continue to learn and to then implement what they learn into their setting. So when we started building this and thinking about working more and more with the pediatric populations, we'd always just done a specific training. Carolina and I actually started it with our peer program here in Calgary when Carolina was a postdoc in my lab. And it was just a couple days or one long night of bringing our volunteers in and giving them this information about the populations. And so we started to expand that and increase that accessibility, right, for people that aren't sitting with us here in Calgary. And so we had 2 modules developed, and these are both available through the Thrive Health platform. The Pediatric Cancer and Exercise one by Amanda and Sarah, and then an adolescent and young adult ones by Dr. Melanie Keats, who I think I saw join the call earlier. And so these are just 2 short, they're brief modules. These are meant to be introductions. They're not the comprehensive full training, but they're the introductions to what is unique about these populations, what's the evidence for exercise, and what do you have to consider in translating exercise to these populations? So how do we tailor it and make it something that's going to work for each individual? As we have started to grow our programs and with impact and with the IPOG, so for those that don't know, IPOG is our International Pediatric Oncology Exercise Guidelines, and we have an international group. Amanda or Emma can maybe post into the chat what our numbers now are in our IPOG network. But as we started talking and as we were doing the work for IPOG, we recognized this need for a more substantive training. And so Amanda and I, along with a number of collaborators, have pulled together this pediatric oncology exercise training that has 7 modules that you can see here. And within each of these modules, there's a lot more detail and other components, and they're all being led and supported by a team of experts. So it really builds upon that IPOC nature of this international collaboration, and how can we pull together the people that are working specifically through these different groups and have this information and knowledge, rather than relying on Amanda and I to go and do all the research and then just present what we learn. So really going to the sources. So you can see the leads here. And then these leads are building the teams and working with others. So there's a lot of people involved in contributing to the content that's going to come out within these different modules. Trainees, clinical and academic collaborators, community partners, other maybe exercise and fitness professionals that they're working with. So this is the leads, but this is a work in progress. So if you're looking at this and you're hearing this for the first time today, and you really want to be involved, please let us know. We need experts for review. So we've got, you're going to see here in a second, the staged process to really ensure that what comes out is going to be the best evidence-based training. And so there's lots of opportunities still for involvement. And I just want to take one step back again here and share, the why behind this. And maybe for some places, when I hear, Miriam talking and Sabine about the work in Germany or the work that's going on in Australia, some places there seems to be much more integration into actual care. Here in Canada, there's really not. We are, for the most part, outside teams often coming in. So a couple of years ago with my colleague Danielle Sentimina, we put together this idea of a pathway. How do we ensure we can start, as David pointed out in his talk, that exercise earlier in the treatment pathway, right? From diagnosis onwards, and not wait until they're out in the community and maybe they find fitness facilities. So this is our original pathways model. And while this was designed really thinking of the adult population, I think the same sort of pathway can be what is applied, and it's what we're doing in pediatric oncology. And our whole pathway really calls for that integration of that trained QEP, that qualified exercise professional. So again, a clinical exercise physiologist or registered kinesiologist in this case, integrated into that healthcare team. We are just starting to get there with some of our projects in Calgary, and I've been doing this for 20 plus years, so it's taken a while. But the training that we're building is really key to this. We can't put somebody in who's a great exercise physiologist but has never worked with the cancer populations, right? So we have to have that training for that individual. And then their role is to work with the healthcare team, the rehab specialists, the oncologists, nurses, to figure out what is best for this child and then get the child and their family to the right resources at the right time. Whether that is a study, whether it is a program in the community, an online resource, etc. So this is the model for integration that we've been working on here in Alberta and at some of our collaborator sites in Canada. Recently, with my current postdoc, Chad Wagner, and Dr. Lorraine Capozzi, a cancer physiatrist resident, we've developed a slightly updated one that really integrates exercise specialists, that trained and qualified exercise professional, within cancer rehabilitation and physiatry. If that's not common for everybody on the call, that's physical medicine and rehabilitation. So they're the physicians that are doing that work. And then they work very closely, obviously, with the rehab team, your OT, PT, speech, and others. And so right now, Calgary has actually a brand new cancer center that opens in 2024. We have an amazing gym in the cancer center and this opportunity to be doing some really unique work in this new setting. And so we're really working on integrating that trained exercise professional who has this specific training, whether it's with pediatric or adult, into this setting, working in these cancer rehabilitation, triage, and referral clinics. So similar to that last model, but you can see here, working with the physiatrist and the rehab team to then, again, get patients to the right care at the right time. And it may be multimodal, right? The child has rehab needs. I had seen one of the comments in there about, well, what if they have neuromuscular needs or other needs? And yes, we want to work with the rehab team, but it doesn't mean because they're doing rehab, they can't also engage in an exercise program at the same time. And really having that transdisciplinary approach with the trained qualified exercise professional is really where we're going. And to get there, we need this training that we've developed. So where we're at with the training, I know there's lots of individuals at the call who are like, oh yes, I probably have to get slides done sooner than later and in to start the review process. So we've invited our experts. We've got those key content areas that they're working on, and we're in this first development phase. As it comes in, we will be giving feedback back and forth using, all of the expertise that we've been able to generate through this IPOG network. And then after we've got where we think we need to be, it goes to an outside panel of experts for those expert reviews, so that we're really not letting any maybe of our biases of what we think of implementation or what we think of that really fully form what's going to be out in this training. We want to make sure we are being as comprehensive and as inclusive as possible. And then the dissemination will hopefully happen this fall. We're trying to target September release. That is Childhood Cancer Awareness Month. And so we'll be disseminating through PEOC, through IPOG, through our Thrive Health Network and all of the core teams, and making this as accessible as possible to as many individuals working in pediatric cancer as possible. The why we're doing this, well, as we built IPOG, we kept coming across whether it was in the literature or whether people were recognizing that it was very varied across different studies, the background training that the interventionists had, that there is this need for training to really standardize this across kind of our field. And this knowledge translation gap of we have studies that are done, but are they going to be effective in the real world? Can we move some of this evidence we know from tightly controlled trials, which are absolutely critical as we generate new knowledge, RCTs, et cetera? Can we move that and make sure that we can train our professionals to be able to translate that into then the studies or the programs that are going to exist, the resources for this population? And so the training is, I believe, central to standardizing our practices, building consistency and enhancing the safety and therefore the potential effectiveness of these evidence-based exercise interventions, whether that is through a study or whether that is through program implementation in clinical and community settings. Whoops, past one, sorry. So the last thing I just want to end on is where this training has really been built from, and that is this IPOG network, as you've heard about a couple times. And if you were here last year, you saw it. And if you're in the network, you've seen the release of it. So we've developed a bunch of resources, and this really goes with that KT piece, right? Like, it's great to have a academic publication out of here's the guidelines, but a family's not reading that. Clinicians are not necessarily reading that. And so Emma, through her work, has been developing these toolkits, and they are free and widely available. These are the QR codes that you can go to download it. And we're studying now the outreach and the use, the impact of these toolkits. So please, if you haven't seen these, go check these out. You can take a screenshot now of these QR codes. You can also go to our website, and Emma will post this into the chat as well. But there's a lot of resources there, and we're really big on the resources are widely available, and you can take them and then change them for your environment. That's the purpose of building these, is to give people a starting point, so you don't have to start from scratch, and you can translate them into your languages and then repost them and then continue to share them out. And so we can continually see us moving the evidence. We know exercise is so important. We know it's a right of children, and yet we don't see it standardized across cancer care. So doing this work will hopefully move us through the training of professionals and the building of such toolkits to having more impact and making exercise more widely the norm across cancer care. So again, thank you for listening to me. We're happy to share resources after our day today, and happy now to answer any questions.